Good morning and welcome to the new episode of Dr. Lamba's Awakening Call. Any country, any nation has to see that the people lead healthy life because healthy life is a happier life. And Canada at one time had an excellent healthcare system. But now what has happened? Waiting for your treatment has become a defining character of Canadian health system. Waiting for treatment. When you're sick, you don't want to wait. You want to get the service. You want to be treated. You want to be cured. But what's happening in India, Canada? In order to document the queues for visits to a specialist and diagnostic and surgical procedures in the country, for almost 3 decades we have seen that physicians across 12 specialties and all the 10 provinces are saying that the system is crumbling. The waiting periods for medical necessity treatments have increased sharply since the last year. Last 1 year has seen a sharp increase. The specialists report that a median waiting time of 27.4 weeks between the referral by your family doctor and before the specialist sees you. In 2021, it was 25 weeks. Not healthy sign. 25 weeks to wait when you are sick and you have been referred to a specialist by your GP, by your family doctor, and now 27.4 weeks. And if you look at the history, this is the longest wait period anywhere in the world. Anywhere in the world, a person who is sick, and even those countries which don't have specialist system, but at least somebody tends to them. And compared to the system prevailing earlier, in 1993, the wait period and today's wait period, today it is 27.4. In 1993, it was 9.3. So it's an increase of 195%. Shall I say it mismanagement? Shall I say crass carelessness and disregard for the people's health? Despite all the claims by the government and all the political parties that they are dedicated to help people, it's not something which can be postponed. It is not something that can be taken lightly. It's shocking. It is really shocking. Now then, there's a variation in the provinces. Ontario reports the shortest wait time. Now, I have been in Ontario for a long time. I've lived all my life, 20 years before I shifted to Calgary. And the waiting time in Ontario is the shortest waiting time. They are lucky. Just 27 weeks, while Prince Edward Island has the longest, 64.7 weeks. More than a year they have to wait before they can see the specialist. And there is also great variation in the specialties. People wait longest for a GP referral and neurosurgical procedures. Wait is 58.9 weeks, more than a year, while those waiting for radiation treatment begin treated in 3.9 weeks. Here, my doctor wanted me to have an MRI of brain, and last month I received a notification that it's scheduled for 26th of May 2023, after 8 months. The total wait time that patient face is something which is shocking. But then, is the government listening? The wait period has increased, for example, in one segment from 11 weeks in 2021 to 12.2 weeks in 2022, 1 year. And the wait time, if compared to 1993, is 242% higher. That's for the neurosurgical. The wait time is something which not only makes the patient suffer, but the family, the sport group, the society, the economy even ultimately suffers. The shortest wait time for specialist consultation are in, as is Ontario, 10.3 weeks for surgical, and highest again in Prince Edward Island. From the consultation with a specialist to the point to which the patient receives treatment, the waiting time has increased in 1 year for 14 weeks. And this is higher by 164% compared to 1993 when it was just 5 weeks. The physicians whom I have talked to, they say that 8 weeks is a reasonable time. If they were to fall sick, I wish they don't, would they think that 8.6 weeks is a reasonable time for the treatment to start? Again, the shortest specialist to treatment waits are found in Ontario and the longest are in Manitoba. Why is it that Ontario, despite all the cribbing, still has the shortest wait time? That shows, A, most of the doctors concentrate over there. And secondly, maybe the more immigrants who come, the immigrant doctors, they want to settle there. Can there not be some incentive for them to go to the other provinces? Now, it's estimated by the Fraser Institute that across the 10 provinces, the total number of procedures in which people are waiting today for the specialty them is 10 million people, 12 million to be more precise. 12 million people waiting to see the doctor in this year, which is coming to an end, and it's likely to increase next year. Especially when the government has decided to have 1.5 million more immigrants in the next 2 years. Would they be able to see the doctors? No way. The already waiting time would extend astronomically. So that even if I look at this 12 million wait time, this means that assuming that each person waits only for one procedure, 3.2% Canadians are waiting for treatment in 2022. The proportion of the population waiting for treatment varies from 2.4% in Ontario to high of 6% in Newfoundland and Labrador. They say there are lies, damn lies, and statistics. Yes. But the fixed numbers, they are frightening. It's very important to note that the physicians report that only 11.3% of the patients are on the waiting list because they requested a delay or postponement. So most of the delay is because of the doctors being preoccupied with other works. Then, diagnostic technologies. As I told you in my own case, the wait period for MRI was much more, but then my doctor said he pushed them and it's likely to be in January rather. The Canadians should expect a minimum of 5 weeks wait for a CT scan, 6 weeks for MRI, and 9 weeks for the and 5 weeks for the ultrasound. A person has a tumor and you ask him to wait how much the growth would be there in 5 weeks, or in my case, as I was saying, 8 months. Data was collected by Fraser Institute from the week of January 10 to September 15, 22. And it has been seen longer the period of collection in years preceding COVID-19 pandemic. Despite the extended period, this year the response rate was 7.5% higher. Imagination staggers. And the result is that the people, the Canadians, suffer. Research has been repeatedly indicated that the wait time for medically necessary treatments are not benign inconveniences. They are a cancerous treatment and they are growing. Wait time can and do have serious repercussions on increased pain, suffering, and mental anguish, as I said earlier. Even not only the patient suffers, but even the support system, the family, the relations, they suffer. And then it can affect their employment, their jobs. So the economy suffers. Totality-wise, when we take the multiplier effect into consideration, this is the state of affairs which I would not even expect in a third world country, what to say of a country which boasts of being a G7 country, great 7. If that is the being great, I'll prefer to live in a country which is not so great. And we have seen in certain cases, the result is poorer medical outcome because the disease which might have been reversible becomes irreversible and transforms the reversible into irreversible and chronic ultimately. And then many times it returns and metamorphoses, changes into a disability. And in many instances, patients may also have to forego their wages while they are waiting for treatment. As I said earlier, it's an economic cost to the individuals themselves and the economy in general. This research by the Fraser Institute indicates that despite the provincial strategy to reduce the wait time and high level of the health expenditure, it's clear that the state of affairs as far as the Canadian patient is concerned is horrible. The wait time is too long to receive necessary medical treatment. And a country which cannot afford to give medical treatment and then boasts of giving millions of dollars to the other countries, isn't it a sham and a cant and hypocrisy? Isn't it a matter of regret and sadness that the government cares a fig for the residents, but is keen to have more immigrants, is keen to show that it is concerned, and then it gives arms for increased fighting. The whole thing smacks of stupidity, bad planning, faulty vision, and uncaring attitude of the governments. There's nothing in the world which cannot be set right. If the government was really caring, they would immediately import immigrant doctors. And here the doctors who come, qualified doctors. I know of the doctors who have been very highly praised, and here what they have done. They have not used their capabilities, but forced them to become cab drivers, real estate agents, and so on. I'm not condemning those professions. No, they are equally important. But there's a wastage and misuse of their capabilities which could enable the Canadians to lead a happy, healthy life. Look at the NHS, National Health Service Scheme of England. Despite the fact that the immigrants, legal and illegal, have practically invaded England, yet the healthcare system is surviving and the people don't have to suffer the way the Canadians are suffering here. Maybe the public here is very, very tolerant and patient, which is an excellent quality. But the country as a whole, I pity the country and I pity the inhabitants as I pity myself. And I can only say with disgust that such governments have no right to rule who cannot care and provide the basic Medicare, and people have to wait for more than a year in many cases just to be treated, which is a fundamental right. But who cares for the rights? Except you and me and the media in talking, but not in practice. Why is it that the media is not raising these questions? Why is these questions are not being raised in the parliament and the assemblies? Why is there no national discussion on this major issue? I leave it to you to judge. And I charge the governments, both the provincial and the federal, for incompetence, carelessness, and absolute myopic vision, which is in fact anti-national. Thank you.